Okay.
अस्सलाम वालेकुम व्यूअर्स। मेरा नाम डॉक्टर फरहान ताहिर है। मैं रूमेटोलॉजिस्ट और पेन मैनेजमेंट फिजिशियन हूँ फिलाडेल्फिया में। टुडे मेरी गेस्ट हैं मिस मरियम आसिम। ये मेंटल हेल्थ एक्सपर्ट है और स्कूल काउंसलर है पाकिस्तान में। और टुडे आई हैव द प्लेयर टू talk to her about the mental health issues and challenges जो कि पाकिस्तानी स्कूल्स में बच्चे फेस कर रहे हैं। कोविड-19 की वजह से बहुत सारे मेंटल हेल्थ प्रॉब्लम्स सामने आ रहे हैं अडल्ट्स में, बट टुडे हम बात करेंगे बच्चों के मेंटल हेल्थ प्रॉब्लम्स के बारे में। सो मरियम, थैंक यू फॉर ज्वाइनिंग। क्या हाल है आपका? अस्सलाम वालेकुम।
मैं बिल्कुल ठीक हूँ. Hope you're keeping well. I'm fine, alhamdulillah.
So, Mariam, first of all, I want to congratulate you for the service that you are providing for Pakistani communities that you serve. जब मैं
I feel
पाकिस्तान में
very,
था, जी, जब मैं
I feel
पाकिस्तान में
very
था,
good that I'm able to do that.
क्या गुड। जब मैं पाकिस्तान में था तो ये कॉन्सेप्ट नहीं था हमारे स्कूल्स के अंदर एक काउंसलर का। साइकोलॉजिकल स्ट्रेस, मेंटल हेल्थ स्ट्रेस हमारे मुल्क में समझा जाता था कि कोई ख़ास अहमियत नहीं रखती, लेकिन अब नॉलेज के साथ हमें एहसास हो रहा है कि ये बहुत ज़रूरी है। तो काइंडली हम थोड़ा सा बैकग्राउंड दें, आपकी जो एक्सपीरियंस है उसको शेयर करें थोड़ा सा, और फिर हम डीप डाउन जाएंगे फर्दर क्वेश्चनिंग
जी
में।
जी, you're absolutely very right. In our days, it was not like this. लेकिन ये हम बहुत खुशी से ये बात कह सकते हैं कि अब, I would say that still the concept of school counselors, it is still in its infancy, but now more and more schools are opting for counselors, which is very good. अभी recently हमें सुनने में आया कि even in the public sector they are trying that there should be a counselor in every school. ये बहुत ज़रूरी है. Basically, it's all about the emotional well-being of the children. Counselors are there to support the emotional well-being of the children, which they need at all ages. Like I deal with children from the age of 3 till the age of 13, like early years, middle school, and then the high school. So मेरा background teaching से है, so and I lecture children about other than counseling, we just visit them in classes, so I can tell them very easily that when they say, many a times children say, what is the thing again they have against the parents कि आप नहीं समझेंगे. So I tell them you can't tell them to me because I'm a parent, teacher, and then a counselor. तो somehow उनके लिए बात करना आसान हो जाता है और हर लेवल पे अब मैं अपने मौजूदा स्कूल में बच्चों को काउंसलिंग प्रोवाइड करती हूँ.
Thank you, and I understand. As a father myself, I know that
Mhm,
whenever there is a health challenge, um,
mhm,
we are worried about it, and sometimes we
mhm.
don't want to acknowledge mental health problems for our
Denial.
kids, and we become have denials. But having a counselor like you, being part of the team, giving people the right advice, as you know how you will treat your parent, your kids, your family members, your relatives, that is a big relief. Again, I think that you are providing a very well needed service. As the digital media is becoming more taking over our lives, it's
Yes.
causing a lot of complex issues which are,
Mm.
the we need our attention. So let us focus today on some age groups and the concerns that
Yes. Right.
kids are having these days.
Mhm.
And you have extensive experience from kindergarten to elementary schools and
Yes.
to high
And the
school.
senior
So
school.
please
Yes.
share a couple of examples for what
Mm.
these young kindergarten kids might be
Mm.
facing these days.
Yeah, well, that's a very delicate age group. Basically, every age group is delicate, but it's a huge transition for very pampered children to enter a kindergarten school. And these transition issues sometimes they really become very difficult, sometimes for the teachers to handle them, and sometimes for the children. So it really works for them, one by one. Now, basically, autism really helped me in many ways studying autism, I mean, because it has made me see the complexities of behaviors very closely. And if we talk about life, so what is life? It is it just it is all about behaviors, one behavior leading to another behavior. So when these young children come to school, we observe them, and their follow-ups are, then the follow-ups are done, and on one, they are just provided the help which they need. Now, something very common which we observe these days is the speech delays. Now, I'm not talking about the hearing and the speech impairment thing, but somehow I've come to the conclusion that due to this overusage of device, you're going to be surprised. Children, many a times, they are in the class, but they are not able to concentrate or answer, or they would not do anything for that matter. Now, the autism awareness and all these intellectual disabilities, it is good that people get to know, but then sometimes people, get worried for no reason. Then we just tell them that no, it's not that, but other than any intellectual disability or something, it is just the speech delay. And then it usually traces down to the fact that the children are just exposed to the device all the time. Think about a child of hardly like 5 years, and he comes and tells me, auntie, I just use my iPad like 7 hours in a row. So that's where the problem lies. So for
Wow.
young children, mainly transition and the communication issues.
Well, this is a eye-opening type of a situation and statement
Yes,
what you just
really,
mentioned.
yeah. Hmm.
That our young kids are not picking up vocabulary,
Yeah.
and their
Hmm.
brain networks are not
Yes,
developing enough to create that speech broker's speech area that we call as doctors
exactly.
and to
Absolutely.
mention
You're
that
very
that
right. We also
that
studied.
development of the brain is becoming stagnant
Exactly.
because of over
Yes,
spending time on the screen because we are just
exactly.
absorbing but not stalking. So
You're
give
very
us
right.
give
Absolutely.
us a little bit of idea of how do you approach this problem then.
Well, I approach it this way. You're going to be surprised if you get to know the, further reasons. Basically, when the young children come one by one, I just visit all the classes and I meet the teachers. Now, usually teachers are pretty trained and they're able to identify, and they would tell me like, Miss, this child doesn't talk at all. And then without making any, without the child getting to know it, I would sit in the class and observe like at least 3 to 4 times. I make sure, and then I actually feel that if there is something, then I would just do one-on-one with the child. And sometimes I have to train the teacher as well, because there's no particular training regarding identifying intellectual disability, or for that matter very sensitive areas like speech, because children are expected to just learn and play when they come to the kindergarten. So then one-on-one attention is provided to the child. Unfortunately, or if we find that there is some real problem, then we properly refer them to the child psychiatrist where the screening is done. Other than that, in case of this device usage and all that, then the parents are usually requested to come over, and we tell them many a times, you have just hit the nail right there, denial. So they would say, no, this is the last thing that we would allow him to do, but it's not like that. And then after some time they say, yes, miss, they use a device. So stuff like that, and then they are told that how harmful it can be. And one thing I'd like to share, which came as really as a surprise, is that many a times children are not found uh, talking just because nobody talks much to them at home, right? Device is another thing, but mostly for the parents who are working, they don't have much time. Now they have their own issues. So ideal all ages, basically men and women, fathers, elder sisters and brothers, when they come. So it is all about time, and they are just trained that, train by train, I mean, it's suggested that they develop good communication with the children, so that they're able to communicate properly in the class, because that is just the beginning of life. And further, these things, if this continues, if they are not identified at this stage, then further what happens is that lack of confidence, very soon it is found by the teacher that a certain child will not participate in the class, or miss, he's not ready to take, he's not ready to talk to children, right? And you can understand the importance of socialization and playing. So there are lots of techniques which are done, and teachers are then trained and like that.
मिस मरियम, आप ने बहुत ही अच्छे तरीके से एक ऐसा पॉइंट रेज किया है जो कि आई एम लिटिल बिट सरप्राइज्ड. I live in a Western world, and we don't
Hmm.
have our families with us. It's
Hmm.
a small single family units, right? So
Hmm.
people, we used to think that our kids are more on screens because there's not
Hmm.
more people in our home, right? If I am
Hmm.
working, my wife is working, and when we come home, we have to cook, we have to
Hmm.
clean, we have to do things, and that's why kids are doing it. But what you're telling me is astonishing for me. Surprise हुए मैं कि पाकिस्तान में हमारा multi families units हैं, even then people are
Hmm.
seeing that
Hmm.
kids don't have many people to talk to.
Many people
So
around. Yes.
that is eye opener for
Hmm.
me. Thank you for
Yes.
sharing such
Yes.
deep
That's precisely
information.
how it is. Yes.
Now this is now in the kindergarten group, you have
Hmm.
raised this important point. Is there anything else you would like to mention before we move on to the second group of age? Kindergarten group में कोई और problem ऐसा है जो आप
किंडर
main
गार्डन में मेनली यही होती है ट्रांजिशन और इस तरह से और बाकी एक पॉइंट है दैट आई वुड लाइक टू शेयर एट द एंड व्हिच एक्चुअली अफेक्ट्स एवरी चाइल्ड दैट आई वुड लाइक टू टॉक अबाउट एट द एंड बिकॉज दैट कवर्स all
okay,
the age groups so
sure,
we can
sure.
move to the middle
So
school.
elementary जो
Yeah, elementary.
kids हैं उनके
जी.
इस age group में आप क्या notice कर रही हैं problems?
Now, elementary school system, now that is again a huge transition as children. Now, most of the schools here, they have separate buildings all together, separate staff. तो वो उनके लिए भी एक बहुत बड़ी तब्दीली होती है एक सिस्टम से दूसरे सिस्टम में जाना. तो उसमें भी यही होता है कि there are a lot of behavior issues that come. And then children, they just visit the counselors. Firstly, they need a lot of encouragement in order to come to the counselor. I would visit them, often, and then they develop the confidence and they would come. But mostly, what is needed in the middle school is behavior modification. I can think of a very cute example. Many a time children would come to me and they would say, Auntie, mere to koi friend nahi hai. And I would say, Acha, chalo, let's see, like, what is the problem? And, they would talk. And then they, of course, first thing everybody wants to listen is that, yes, you're right, that everybody is not doing justice to you that you don't have a friend. But then, very subtly, basically, autism studies has made me once again able to do all this because I'm used to doing a very detailed analysis of behavior, right? So we do FBA, functional behavior assessment. So these are also behaviors, and those like there are really complex ones that we do. But anyway, the child complaining about this thing that he doesn't have a friend now, or like nobody trusts him for that matter. So when we work around the trust thing, then somewhere we get to the point, in a very subtle manner, that the child gets to say again, yeah, I find that I'm a bit arrogant at times. And yes, I displayed, very inflated ego and stuff like that. So then they're able to basically get to know about their behaviors and how they can bring positive changes in themselves so that they end up having friends, which is the basic thing. And then follow ups are done. So it's really nice. It adds to their confidence and everything.
Miss Mariam, I can see that how you bring in the kids with your compassionate nature and your loving nature, that you attract the kids and let them open up. Even with adults, sometimes it's very hard to for us
Yes,
to
it's
admit
pretty
our
hard.
shortcomings, right?
Yes.
We all are at times behaving selfishly, arrogantly, and
Many a
it is very
times.
hard, and we don't get to reflect upon our behaviors. But your loving nature allows kids to trust you, and they
Mm,
open up,
mm,
and that's a
mm,
great asset. So you
mm,
mentioned that in elementary kids we have
mm,
kids who have lack of
mm.
friendships because
Yeah.
of maybe lack of
Mm,
better communication, trust,
yeah.
and behavior. And now kids,
Mm,
with through your help, have been able to
mm,
introspect and reflect
mm,
on their behavior and try to improve upon it.
yes.
Excellent,
Mm,
excellent. I am
mm,
learning that this is something that is really important
mm,
for all kids to actually routinely go through this, because
yeah.
um, sometimes kids are also facing, and I'm going to pose a question because I have kids in
Mhm,
this age.
mhm,
We live in a predominantly white population, of where 95% of kids are Caucasian, and sometimes kids are
mhm.
picked upon on the color of the skin.
Yeah.
Sometimes other kids would say, well, you are
Mm,
not an American because you're brown,
mm,
and all that stuff, and that brings them issues. Sometimes
mhm,
features of their body, hair, uh,
mhm,
physical appearance also bother them at this age.
mhm.
Do you have also found that as a problem in your schooling, in your
Yes,
schools?
now exactly. You're going to be surprised once again that the same happens in our community. Of course, we don't have, it is not that multinational, and usually the ethnicity is the same, but still, it is quite a big problem. And actually, I'd like to have a fully, a separate program about bullying. See, that's what you were
Yeah,
referring to.
yeah.
Yes, all these things happen. Yeah, all these things happen here as well. And, endless examples come to my mind. But, it's such a
It's you are recognizing
difficult thing
that
to say
also
that.
happening. Yeah.
Yes, absolutely. Height, complexion, and endless things. And, mostly in the elite schools, children are from the elite backgrounds, but then there are others from other uh, economic groups as well. So many such things come. So that's part of the routine, just dealing with all that.
Wonderful. Okay, so now what I would like to ask you about, is there anything else you want to add before we
Yes,
go to the
yeah.
senior school, elementary school
Yeah,
problems?
exactly. I would like to say, no, like I said, that for the middle school and for everybody, basically, behavior modification is needed, which helps. Now, you said that, they are made to reflect upon, yeah, that is one thing. And additionally, ABA, like a science, like applied behavior analysis, it just does not, it's not restricted to intellectual disability or autism, but simple ABA, I've taught it to many teachers, like what is a positive enforcement, what does it do to a child, and a negative reinforcement. How does the ABC antecedent behavior and consequence, this thing, how does it work, and how can a teacher use it in a practice? Because at school, we just tell the teachers a million times it's the teacher who can either make the child or break the child. I'm basically practitioner of spelled framework has been devised by Julie Beadle Brown at University of Kent, and it is adopted by NAS, National Autistic Society, England. So, in like the first three letters in spell framework stand for structure, positivity, and empathy. Now, these are the three elements which everybody needs. See, so that is how behaviors are turned, towards a better direction at all ages, especially in elementary school, as children are learning more and more things, and it is just the time when they're experimenting. So they need a lot of structure, which is provided to them. And I deal with the parents, men, women, all ages, as they contact us through the children for the betterment of children. So that's how we do it.
So मरियम, थोड़ा सा आप दोबारा ज़रा elaborate करेंगे लास्ट पॉइंट को कि तीन important features आपने बताए हैं. Structure, there was empathy, and the third one was?